Let's talk for a second about apple cider vinegar. So this is a new viral documentary on Netflix, and the story really revolves around this person right here who is playing a character based off of Belle Gibson. Belle Gibson is an Australian influencer who had a very successful app called The Whole Pantry and a cookbook by the same name, who was faking having cancer. And she said all kinds of crazy things in real life. She said that she got cancer from the Gardasil vaccine and that she had multiple different cancers. None of this was true. She never had any diagnosis of cancer and was lying the whole time. Although the documentary is focused on her, this character right here was kind of upsetting and felt personal to me. This is Milla. So in the documentary, Milla is a young woman with a sarcoma who chooses to not do medical treatment. So she decides that she's going to go to a fictional Hirsch Institute, which is modeled after Gerson therapy, who I've had, unfortunately, multiple patients do, where they do coffee enemas and juicing to try to heal their cancer. So this character was based off of Jess Ainscott, I think is her name, who is also an Australian influencer who actually passed away, who also had sarcoma in real life. And so she had a popular wellness blog and was convincing patients to not treat their cancer with medical therapy and follow this Gerson therapy, which ultimately took her life. It's a really sad story because in real life her mother also had cancer and also refused medical treatment, and they both passed away. So I was reading some commentary about this online, and people were very surprised at her father's reaction, the real life person who this character is based off of. So he has been giving interviews upset about this, saying that his daughter didn't die from her sarcoma, she died from medical treatment. So in the last year of her life, her cancer had spread and she was not being truthful with her followers. And she had a large fungating tumor that was bleeding. She says this herself in one of her blog posts. And eventually, at the very end of her life, did decide to seek medical treatment and was apparently having radiation therapy, but passed away anyway. And her father, in his critique of this miniseries, is saying that it's incorrect because she didn't die from her cancer in real life. She died from the medical therapy. And people were surprised at this because it's quite obvious she died from progression of her cancer from not having treatment. But this is something I see very commonly in my patients that refuse medical treatment, is that they often, even in the end, cannot admit that what they were doing wasn't working. So I unfortunately have had many patients in my career choose to do surgery and then forego adjunctive therapy like radiation and chemotherapy when it's indicated, and do Gerson therapy, all kinds of other things. And I have never had a single patient live to tell the tale. And it's really hard. And I try really hard to talk with my patients about their choices and help them to make empowered, educated choices. But there's just a population of patients that are very attracted to this. And I think what I hope people learn from watching this documentary is that it's not real. No one's curing horrible cancer with juicing and coffee enemas. It's just not happening. And if it was something that worked, we all would do it. And always remember, all we know is that we have things we know work in medicine, things we don't know if they work in medicine, and things we know don't work in medicine. You should always choose things we know work, and you can do along with it things we don't know. That's completely fine and often very helpful for patients. But never forego the things that we know work for things that we don't know, or certainly not for things we know don't work.